our training. However, they're here learning a lot of other things at the same time. And we have a beauty here from TikTok that come to see us to just get some facial balancing. She already looks good, but she's lost some recent weight. So I want to give her that heart-shaped look back and improve her under eyes a lot. And I always tell people one of the key areas that so many girls like, I know my medical assistants can for sure talk about it, is the chin area. This area tends to resorb and just not give as much balancing to the face. When you have the chin back, it makes so much of a difference. People go crazy over having their chin done. So I'm going to do a little bit to her chin, and I'm going to do a little bit to the mid face, and then we're going to improve her under eye as well. The chin tends to need more filler than you guys would think. With her, I want to give her a little bit higher of an arch because I really want to accentuate what we're trying to do for her, which is to improve her under eye area. She recently lost weight, which I congratulated her for. It's very hard to do nowadays, but easier with some of the medicines that we have. I'm on Manjaro, you guys, because I believe it's anti-aging, not only for weight loss, but also helps the brain, helps the heart. And so we're just going to sculpt her cheeks. I feel like every girl needs high cheeks, right, Daisy? Daisy over here agrees. What do you think every girl should have when it comes to facial sculpting? What are the key areas?
Cheeks, chin, and jawline.
Yes. And you didn't say lip?
And lips.
I'm surprised. You love lips. She loves lips. No, but you're right. Cheek, chin, jawline, that's the key areas. I know. Well, she's excited. That's why. When you're super happy to be here, when you're super happy, I'm telling you, the pain is much less than you'd think.
And she has a full live audience.
We're using Restylane Define here. It has a little bit more of a thicker structure, can give her a little bit more lift, will last her close to a year, which is great. And I'm doing a little bit more of a high arch for her because it's going to really help pull up her cheeks along with the threads that we're going to do. I just want her to see like that contour, you know, that lateral sort of shaping when, and you could see that pop, see right there? When she looks at herself from the side, overhead light, whatever. We just need her to have that extra pop when it comes to the filler. So now we've done a little bit in each area. Now, long term, you can always add, you guys, but this, let me see from the front. That looks really good. Already looks better. Look, you could see the heart shape. Look, she has more of a contour through here. She has a little bit more projection in the chin if you come to the side.
Yes.
Yes.
We can reverse filler depending on what it is.
There you go.
You really have to see it.
So now we're going to use a cannula, you guys, just to do a little bit through the under eye. This area tends to be a little bit more sensitive. Hold on. And I tend to like to do this more. Years ago when I used to do cannulas everywhere. You guys can see, look, the cannula is here. Okay, so we're kind of in the tear trough. We're going to blend that down into the deep medial fat pads so that it kind of just lifts the whole area. You don't want to overdo the trough because the trough can get puffy, but we support the whole area by blending. There we go. And working to the deeper fat pads of the eye. There we go. Perfect. Okay. Now let's go to the opposite side. She's doing great. Almost done with the filler. Turn a little bit this way. Smile for me a second so I can see. So you guys see, look, the discoloration is her natural discoloration, but look at the line here. That line's now gone. Look at her cheek elevation. And the chin, we could do a little bit more, but I still like that improvement already. It looks really good. And again, the cannula will limit bruising and swelling. This is not a long needle. This is actually not sharp. And it just feels weird when it's going in. Some people have a little bit thicker. And again, here's the cannula. You guys see it here in the trough.
All right, we have a lot of questions from YouTube.
What are they saying?
So wants to know, Doc, what are you doing exactly? They put their full name on here. We can call it out if you want.
Sure.
Nick David Hagen.
Okay, Nick. What are they asking? So tell them what we're doing.
You guys, we're doing female facial sculpting. Our patient lost a little bit of weight. We're just going to replace some volume, give her the heart shape look. that we always do such a great job as she does not want to look unnatural.
No, I need her to look amazing. And I
Because
don't want
she's a
anyone to know
champ.
except if they saw her on TikTok. So that's it for the filler. So what do we do, you guys? What do we do right after we do the filler?
We're gonna do the Emer reveal.
Right. And look, she didn't even bleed. It's unbelievable.
Perfect. Didn't flinch, didn't
So, all right. So now we're gonna do an Emer reveal. Just want to make sure everything's really smooth.
bleed.
It is.
Before the threads.
Yeah. So give her the phone. You're gonna look at yourself,
All right,
45-degree
here we go.
angle, because it
Take a
shows you
selfie.
the best light. So here, hold right here. Hold with here. There you go. Now take a look. Look up though in your chin. So I want you to see chin and cheek. Look at what do you think? So a little bit of height, a little bit of length here, and then we soften the hollows there so that when you smile, there's really no lines anymore. But I want you to look at yourself 45 degrees. Turn a little there. Look now. No more line. Look at the height on the cheek, and then look at the chin. What did you want? What was your goal? I want you to look at it in the mirror.
To fix the under eye.
Like the hollowing and
The
stuff.
hollowing, yes.
Okay, so now take this because it'll be easier for you to see. When you're darker, it's harder to tell.
Mm-hmm.
Do you see what I'm saying? So that line is not there anymore. Do you see the height of the cheek
Mm-hmm.
and the chin? What do you think?
It looks good. It looks good, but I could like feel my eye.
Yeah, that's the numbness in the medicine.
Okay.
So that's one of the things that's actually good learning, you guys. There is numbing medicine inside the filler. So sometimes the eyes feel weird. It'll be a little like an hour probably before because there's numbing through there. So it feels like you can't blink or whatever. What we have to do is give it 1 to 2 weeks, let it settle so it smooths out. The eyelid filler tends to hold water and then smooths out over the next week or two. The cheek filler is a little bit like bigger and then it becomes a little bit more blended. But I wanted you to have this elevation because when you elevate here, look, it improves the line here. So in the next couple of weeks, as this pulls back a little bit, you're not going to notice the line so much. All right, so we're going to do a little bit of a blending, and now we're going to do the lifting part. Come take a look at the pictures. Yeah, but look, let them scan you.